Hello everyone and welcome to my channel. My name is Maria and on my channel I create videos around everything nursing. I also have a handful of lifestyle content. I am trying to get to 10k subscribers, so I'd really appreciate it if you subscribe to my channel and also gave this video a like. Not only does it help with the growth of my channel, it also tells YouTube algorithm that you guys would like to see more videos like this. So this video is going to be such a random video, but I thought I'd just do it anyway because I think it's going to be, one, informative, which is what I always try to do in all of my videos, and I think it actually just might be a bit funny, like it's just like a really quick and light-hearted video. So right now I'm on a website called Quora. I think some of you guys might be familiar with it. Oh, it's not coming up, but it's Quora. And I was just doing some stuff like the behind the scenes of YouTube, and somebody asked a question saying, what is everything they don't tell you about becoming a nurse? And no one is really no one's really answering any of the questions. So I scrolled right down to the bottom of the webpage, and there's a whole bunch of like related questions, so I'm just going to answer them. We'll just see how this video turns out. So the first question is becoming a registered nurse worth it? And honestly, I really do think it is down to you and what is it that you are looking for in a profession. If you're looking to help people, well and good, that's all dandy, you know, sell ice cream and you can help people. There's so many things that you can do to help people. You don't need to be a nurse to help people. I was speaking to the admission department at a certain university and she helped me. The guy who collects my rubbish, he helps me. The person who does the food through Tesco's when they're scanning the food, they help me. So if you do want to help people, don't think that being a registered nurse is the only way to do it. If you're doing it because you want to make money, then there are other ways to make money. You know, wanting to become a nurse, it's a culmination of different reasons, and that will help you to come to a decision about whether you think it's worth it or not. Directly asking myself this question, oh my gosh. When I was a nursing student, it honestly depended what day you asked me. If you asked me a certain day, I'd be like, yeah, it's hella worth it, like, oh my gosh, I'd recommend it to everyone. And there were certain times, if you would ask me, I'd tell you, mate, I'm writing my letter so I can drop out of this degree because I don't want to do it anymore. So it really does depend. Is becoming a registered nurse worth it? Now that I have been a registered nurse for 2 years now, I would say that it is worth it, because I really do think I really do think that I've had like a massive mind set shift. So honestly, do I think becoming a registered nurse is worth it? Yes, primarily because if you are a registered nurse, if you do become a registered nurse, it doesn't mean that you are locked down into it. You can do so many other things. If all I was a registered nurse, I had no hobbies, I had no friends, I had nothing to do on the side, then I would tell you it is not worth it. But if you are a registered nurse in combination with a whole bunch of other things, then it is definitely worth it. And it doesn't just go to being a registered nurse. I was having a conversation with someone the other day, and I basically said, if you're doing anything that takes up 100% of your time, it isn't worth it. Whether that's you being a registered nurse, whether it's you being a doctor, whether it's you being a cleaner, whether it's you being a gardener, whether, you know, it's something that you've worked for the whole of your life. If you're doing one thing that takes up all of your time, that doesn't leave space for anything else, then it is not worth it. So make sure you find a balance. So right now, is being a registered nurse worth it? Totally. Next question. Can I finish becoming a registered nurse in less than 4 years? Definitely, but again, it really depends on where you're starting. If you finished your A-levels already, then yeah, you can just sign on to a 3-year bachelor's degree or an associate or apprenticeship program, and yes, you can become a registered nurse. I do want to say that when I'm referring to registered nurse, I'm not talking about auxiliary nurse, I'm not talking about healthcare assistant, I'm not talking about nursing assistant, I'm talking about a band 5 registered nurse. You're registered with the NMC, you have an NSC PIN number, and yeah, your title is a registered nurse. That's what I mean about registered nurse, because sometimes the word nurse, registered nurse, is thrown around lightly or loosely. Nurse is not a protected characteristic. So you can have literally anyone calling themselves a nurse, an assistant, a healthcare assistant. The word nurse is not a protected characteristic. You could be a teacher and call yourself a nurse and advertise yourself as a nurse, and nobody can legally do anything, you know, about that. However, the moment you call yourself a registered nurse here in the UK, then there are legal and, you know, ethical and so many different connotations attached to it. I am a registered nurse. I'm not just a nurse, but I am a registered nurse. So that's what I mean in the video when I'm referring to nurse, registered nurse, all of that stuff. There was actually a story of a guy, where is he? I think it was based, I don't know where it was based, but during the whole political campaign, and his whole selling point was that they wanted to improve everything for nurses and stuff like that. And throughout his whole campaign, he kept saying, my experience as a nurse, my experience as a nurse, my experience as a nurse. He ended up winning. I believe he actually ended up winning. And then someone actually found out that, mate, you're actually not a registered nurse. And he was like, I never said I was a registered nurse. I just said I was a nurse, which he kind of was. He was a healthcare assistant, and some healthcare assistants do describe themselves as a nurse but not a registered nurse. Same thing with like mothers who breastfeed. Some of them describe themselves as nurses because they're breastfeeding their child, but they're not necessarily a registered nurse. So choose your words wisely. Which are some of the pros and cons of being a registered nurse and registered dietitian? I'm not a registered dietitian, I'm just a registered nurse, so I can't really answer that question because I'm not the both of them. What do you hate about being a registered nurse? Hate is a really strong word. What I hate being about registered nurse is that, I can't really think about this from my head. I don't want to offend anyone. What I hate, there's something I hate about being a registered nurse. And if there's something that you hate about being a registered nurse, then maybe that's just ignorance. What do I hate about being a registered nurse? Well, I hate that there are loads of pen pushers in the NHS who don't actually do anything. I guess you could say I hate the pay because the pay isn't great. I hate the working conditions in terms of how we're treated behind the scenes when you're not with your patients, because I feel like, you know, for a lot of nurses the working conditions aren't great. Yeah. We're not even going to do that in this video. How hard is it to become a registered nurse? I don't think it really does depend. I was going to say that I don't think it's too hard, but it really does depend on your academic background, what level 2 or level 3 qualifications that you have. It depends on where you live. It depends on how much money you have, because there's a lot of things that go into being a student nurse and then becoming a registered nurse. You also have a lot of sacrifices that you have to make. Like, I know of some people who are registered nurses and they legit sometimes they go days without seeing any of their kids. And I think sometimes people think that, oh, being a student nurse is super hard, and then once you're a registered nurse it'll be easier. And I was so naive. I actually thought that. I remember one time with one of my mentors, I had like quite a few essays and assessments due, and I was also at placement. It was a hectic time. And I remember in passing saying to her, like, I can't wait till I become a registered nurse. It'll be so much more easier than being a student nurse. And it really isn't the case. Like, there are some things that are easier, but there are some things that are harder. So yeah, being a registered nurse is hard. It can, depending on where you are at in life and what other things you're going through and other commitments that you have, being a registered nurse can be hard. And becoming a registered nurse can also be hard. Again, like I said, some people have to sacrifice a lot. Like some people go from full-time employment. Like, I know of a nurse at my hospital. She was actually like working in IT, making big bucks, and she wanted to become a nurse. So she had to basically quit that job, quit like a multiple pound salary, be a student nurse, be broke for like 3-4 years before she could become a registered nurse. So it depends on how much you have to sacrifice, how much you have to give up, and how much you kind of have to adapt. These questions are so negative. What the hell? Okay, I'm going to miss some of them out. Can a nurse become a doctor? Yes, anybody can become a doctor. I know of, I think I've met maybe one doctor who used to be a nurse. So he did like his whole nursing degree, and then he was a nurse for like a year or two, and basically just went to medical school. But rather than starting as if he'd just done his A-levels, he basically just did a graduate degree in medicine, which was 4 years. So yeah, anybody can become a doctor. Absolutely anyone. Next question. I don't know why these questions are so negative and like, oh. Are there any dangers associated with becoming a registered nurse? of course. There's dangers with life in general, but are there dangers associated with becoming a registered nurse directly? Yes, there are a whole bunch of occupational hazards, if that's what you mean, in nursing. For example, you know, we think of the whole COVID pandemic that's going on. You're basically putting your health at risk, whether you have the correct PPE or you don't have the correct PPE. Things even before the COVID pandemic, in terms of like working 12-hour shifts, you're standing all the time, it really isn't good with like pooling of blood in your legs. I know some nurses like have to wear stockings, because if they don't wear stockings, their legs get really swollen. Some people, a lot of nurses suffer with foot pain. Some nurses are walking with a limp. Then you may get that in other professions as well. Working long 12-hour shifts isn't easy, especially if where you're working is understaffed and there's not enough nurses and you can't always take your break. Having to wake up super early in the morning, depending on how long you have to travel. Yeah, there are all occupational hazards. I think of things like some of the products that we're using to clean, like we use a lot of bleach in healthcare. That cannot be good for your health. Mixing certain antibiotics and stuff like that, I'm sure that if the antibiotics are mixed in the incorrect way, then that can have a negative impact, not just on the patient, but also for yourself as you're mixing it. I know that there are a couple of medications that females can't touch, because if you touch that medication, then it can have a negative impact on your reproductive system. So just being aware of the hazards and obviously putting things in place to reduce the likelihood of that hazard actually being realized. So yeah, there are a lot of dangers associated with becoming a registered nurse. Abuse as well that you get from patients, because nurses are predominantly female. I know some people don't want me to go there, but because nurses are predominantly female, I feel like sometimes, not that I feel like, because nurses are predominantly female, sometimes people don't give the profession the respect that it deserves, in terms of not being rude, not being abusive, and you know, just things like that. I honestly believe that if the majority of nurses were male, then we wouldn't be facing a lot of the issues that we're facing, but that's a different story for another day. We don't need to go there. What's the next question? Where can I, as a registered nurse, make the most? I'm not asking about advanced practice nurse, strictly with RN registered nurses. So he or she's basically asking, where can registered nurses make the most money? Anybody can make the most money, but this is specific for registered nurses. Okay, registered nurses can make the most money if you work in any major cities and if you are specialized, but they've said not advanced practice nurses. So if you just go for if you work in a major city, if you're working weekends, on a night shift, public holidays, that's where you can make the most money. So yeah, go for the cities. And if you're working basically undesirable shifts, night shifts used to be called graveyard shifts for a reason. Is becoming a registered nurse hard? What are the steps? I've kind of already answered that, and I do have a video on my channel that kind of goes through the steps of becoming a registered nurse. Generally, you want your level 2 qualification, which, you know, most people it's GCSEs. Then you want your level 3 qualification. For most people, it will be their A-levels, IB diploma, or an access course to nursing. Then you sign on to a nursing course. Most people go for the 3-year undergraduate the 3-year bachelor's program. Some people who are already working as healthcare assistants, then they may go through the nursing apprenticeship or the nursing associate route and then top up to become a registered nurse afterwards. Some people who may have similar degrees, for example, you may have a degree in midwifery or a degree in sports science, then you can just do like a postgraduate kind of top-up degree. They tend to be anything from like a year and a half, a year to maybe 2 years, depending on if you want to finish with just, you know, a standard bachelor's or if you want to finish with a master's degree. But I do have a video that kind of goes through the steps to that. Next question. What is something no one tells you about becoming a nurse? I felt like I kind of knew everything that I needed to know about becoming a nurse. Like, I don't feel like I was blindsided. What is something that no one tells you about becoming a nurse? I just didn't realize that. I thought being a nurse was more flexible. Yes, that's one thing. I thought that when being a student nurse is different, but she said about being a nurse, I'm just going to say registered nurse. But one thing that no one really told me about being a registered nurse, and one thing that I didn't really seek to find out, was how flexible being a registered nurse was. I thought being a registered nurse was flexible in terms of the fact that you could pick what dates you wanted to work, and you know, you hear of a lot of nurses saying, oh, I only work 3 long days a week. It doesn't always work like that, and I kind of wish it was like that. That's one thing no one told me. I didn't realize like how much power the employer I didn't realize how much power the employer had over its employees when it came to nursing. Like, they can literally just say, this is when you're going to work, and sometimes you just kind of have to do it. So that's one thing I didn't realize. I thought you had more autonomy, not in terms of, you know, you and your patients, but I thought you had more freedom in terms of you and, you know, the people that you're working with, especially when it came to shift times and, you know, things like your salary. Another thing I didn't realize that all nurses were paid the same, in terms of the fact that if you were a new grad on ICU in comparison to a new grad on outpatients, I would have thought that in areas where, you know, the skill set required was higher, I would have thought that generally the pay was higher, but that isn't the case at all trusts. So those are two things that I was unaware of. I wasn't aware of the degree of flexibility that you don't have, and the degree of freedom that you don't have. And I also wasn't aware that the pay, I didn't know the pay was so rigid. I really didn't think. Like, I knew the agenda for change was a thing, but I thought there was some sort of negotiation around it, but it really isn't there as much as I thought it was. What tests are needed to become a registered nurse? There are no kind of national tests in the UK that you have to take before becoming a registered nurse. But obviously, you know, some universities, some educational institutions will, you know, require you to do like a general maths, English test, make sure you have relevant qualifications. But unlike, you know, kind of the medical profession, we don't have like the UCAT and the MCAT and all of that stuff like that. How long does it take to become a registered nurse? It really depends on where you are at, but the standard bachelor's degree takes 3 years. Last question is, how do registered nurses become rich? Lol, that is so funny. If you're in America and you want to become rich as a registered nurse, then you can do like crisis nursing and all of that stuff. But if you're in the UK and you want to become rich as a registered nurse, then make sure you have an additional profession. Basically, make sure you have like a business on the side, or something like that. Solely relying on your nursing salary to become rich is not going to happen. The money that you do make sure you're investing your money, make sure you invest your time, and if you are interested in starting a business, then maybe start a business and stuff like that. Just make sure you use your money wisely and cut your cloth according to your size. So yeah, those are the questions that I have been asked, or that have been on the Quora. If I'm saying it wrong, guys, tell me. That was just a really quick and a fun video. Anyway, make sure to subscribe to my channel, give this video a like, and I'll see you guys in my next one. Bye.